Welcome to Lakeview Regional Medical Center's House Call Series. I'm Jenny Gensler. We'll be starting in about 30 seconds as we give everybody a chance to join live. If you're on Facebook, please check in. You can type a comment live. We're taking questions. We'd love to know where you're calling in from or where you're watching from. We're going to give it about 30 seconds to get started. We're looking forward to having this conversation today. We know this is a topic that really needs some exposure to the community, right?
Absolutely, absolutely. This is a very difficult time we're all going through, and it's very important for everyone to know that we are out here to help. So just
we're going to give it about 10 more seconds. All right, we see people are joining. That's good. That means we're actually alive. Okay, great. We're going to go ahead and get started today. So again, welcome to Lakeview Regional Medical Center's House Call Series. I'm Jenny Gensler, and joining me today is Dr. Jose Rodriguez, a licensed psychiatrist and the medical director for our adult inpatient behavioral health unit. Today's topic is about handling crisis with seniors during COVID. So we're going to cover a lot of information. He and I have been talking about this even as we prepped for it. This is a big topic, and so we're going to have to skim a little today, but this is an important message we'd like to get out to those of you who may have adult family members that are dealing with crisis during COVID and how that's affecting our seniors in more ways than it may affect the other members of our community. So let's jump in and get started. Welcome, Dr. Rodriguez.
Yes, hi everyone, welcome. And again, this is a very important time and to be there for our loved ones, and this is very challenging. We're experiencing a crisis we never had before, so this is even more challenging for everyone. This is a time that our seniors are very more concerned because they're the ones who are affected the most for the COVID virus more than anyone. So it's important for us to be there for them, knowing that this virus, makes a big impact on them because they're more isolated more than they ever were before, and they're very concerned about getting the virus.
And that's the challenge. We know our seniors, they are the most at risk for medical complications from catching the virus, and so they've been very diligent about social isolation and social distancing. But talk to us about, what is it like to be a senior when they're watching the news and listening to all this craziness about the virus? What are the fears that they're experiencing that maybe are somewhat different than what we feel?
Well, obviously the main one is they're worried about catching the virus themselves, or maybe passing the virus along to someone else that they love, or one of their friends, or one of their loved ones. And, being with that said, the interactions are actually less for the seniors, and therefore, with the less interactions, it also complicates the ability for them to get services that they need, or also complicates their interactions every day. So it's a very concerning.
We talked about one of the places that seniors rely on a lot of times is churches, and that's been taken away from their daily routine.
Absolutely.
And also, a lot of our seniors already have medical conditions, and they were fairly regular with doctor's appointments and regular at seeing physicians, and how has that been affected?
All the services have taken a hit on, and all the services are less now. So even for the basic needs, the services are less. So it's harder for them to do their basics and get their services that they need.
And so you and I might not think anything of missing our doctor's appointment for a couple of months and putting off this or that, or maybe our prescription ran out and we kind of have to stretch. But for a senior dealing with a real medical concern, that's a real stressor for them. And a lot of times they're already, like we said, they may be dealing with a medical condition, but there's also common mental issues that our seniors deal with that may have been existing prior to COVID. Tell me about that.
Absolutely. There's a lot of people already suffer from depression, anxiety, chronic pain issues, bipolar. So even if someone is completely healthy, this time and this crisis is enough to make someone who doesn't have any mental health issues experience some significant mental health issues. So we have to keep it on the radar for everyone to be, monitored and also, just to
You
kind
gotta be
of
vigilant with your family, checking in more than
Absolutely.
usual.
definitely you want to call more, you want to reach out to them, FaceTime them. Obviously, if you're concerned about visiting them and not giving them the virus, but FaceTime, call them, maybe offer them assistance to get some of their basic needs, some of their groceries. You don't have to physically be there, but you can drop them off maybe, or something of that nature, just to be a little more helpful, to know that they're still having the support and the love that they need, because without that, it's going to be difficult for them, and they're going to lose that ability, the failure to thrive, knowing that no one's there for them and everything else. So it's important to now, out of all times, to call more often and reach out more.
And I think that's part of it is, are we helping them by FaceTiming? Do we, maybe they were resistant to that. Maybe you've got a mom or dad who's like, I don't need to do that, I'll be fine. And they've just been talking to the grandkids on the phone. We know, I think it's worth mentioning that some of our seniors are still in nursing homes, and speak to that. That hasn't really changed.
The nursing homes are definitely a challenging environment, because over there, a lot of them aren't having visitors, so you can't have visitors. There's less interactions. You're very isolated, and when you're isolated, your mind isn't free to think freely of certain things, of daily activities. Instead, it's going to sit there and obsess on the negativity of things, and everything that you're worried about, it's just going to exacerbate. So we definitely want to interact with those guys even much more.
They're stuck with the TV, right? That's probably the majority of the socialization, that someone who's living in a nursing home, there's too much time sometimes to watch the media, which is not going to help their
Absolutely not. On the media, there's so many, I guess, negative things on the TV that it's going to make it even harder for them to be free and think well and think of the future that's going to be a little bit brighter when it's all they have.
I think we could all use a dose of cutting back on watching the media and realizing that you take a full day off from the media, you actually feel better right now, because nothing's changing so fast that it's got to be like it was early on. I think everybody could probably benefit from a break in media right now.
Absolutely.
So one of the messages we want to get out today is, how do you recognize when you've got a real crisis situation? You're watching today, you've got elderly parents or a parent that you're somewhat worried about because things are a little different, or the stress and anxiety that they felt during the beginning of COVID has not lessened as the pandemic has moved on. Let's talk about, what does it look like when somebody's really possibly in a crisis where a loved one should be concerned?
Well, obviously, look for little signs and symptoms when you have discussions with them. Obviously, they're having signs of hopelessness and just too much feeling like they're a burden and things like that. You want to kind of keep it on the radar. And obviously, little things of their daily routine, if that's completely off, if they're not sleeping well, and not eating well, not bathing, not taking their medications. But one of the main things that we see is the sleep.
Talk to us about that fact you told me.
Yeah, there's been studies before that if you don't sleep after 20 hours of being awake, it's almost comparable to being legally drunk. So if you haven't slept in 20 hours, your thoughts are impaired. So it's very important to know that they're sleeping well. They're getting that 6 to 8 hours a night of sleep, because if they're not, their thinking and their ability to function throughout the day is going to go downhill pretty fast. And if their thinking is not well, then also their medical conditions will also not be well, because then they won't be taking their medications. And if they're not taking their medications, things can spiral down really fast. Because not only your mental health is bad, but your medical conditions could be a crisis as well. Not only is your mental health. So we just got to keep everything in perspective here.
And those two things go really hand in hand with our senior community. So medical conditions cause mental anxiety. Existing mental conditions that are not intended to could lead to medical issues as well. And so it's important to watch the balance of both of those. And you know your loved one better than anyone else. Talk to me about drinking and alcohol or drug abuse with seniors.
Yes, obviously, with the the mental health issues, the medical issues, and now we have a social issue crises right now with additive factor with the COVID virus, of course. And also, that will cause a lot of anxiety and stress. And then the drinking could be a little bit more, or use of anxiolytics, which help with anxiety, because right now anxiety is like really through the roof.
Mhm.
The fears, fear drives the anxiety, and when you have a lot of fear, we just got to be cautious of what we use to maintain that anxiety, because if we use the wrong thing, yes, it might temporarily help, but overall it could worsen your condition over a short period of time, and that's another crisis that could also happen. So we're worried about that as well.
So what do you do? So your loved one has exhibited some of these signs. You know they're sleeping less than they normally do. You know they're not following their routine. Even now that maybe they're able to get back to church, they're not going, or they're having opportunities to interact with the grandkids and choosing not to. Those are signs. So when is it time to take action?
Well, if you have any concerns, of course, we want you to take action, possibly get them to their primary care physician, their psychiatrist, or any other provider that you can have them be seen and be thoroughly examined, a local mental health clinic. And if things are pretty significant, obviously, we don't want you to waste around any time. Bring them to the local emergency room, or call 911 to, have the EMS go out there and pick them up and bring them in if they need to. And, any of the conditions of, of course, obviously, if they have any thoughts of not wanting to live anymore, that's a clear indication. They're not sleeping well, they're not taking care of themselves. Yes, bring them in to be seen right away.
So if you can safely bring them, do so. If they're resistant or you feel that you can't safely bring them in, you can call 911. And what happens if that's the case? What's next?
Well, obviously, they'll be screened, they'll be brought to the emergency room, they'll be screened to see if they need further assistance. And if they do, they'll probably hospitalize them if they do need further assistance.
But it could be a medical condition, so they get
Absolutely,
medically
they
cleared.
get medically cleared, so they get looked at for both.
What's a common thing that you'll find in an emergency room where maybe they were exhibiting some psychiatric symptoms, but it turned out to be a medical condition? What's a common?
Obviously, a lot of we get comments that they might just have like a urinary tract infection, and that can easily throw them off easily, with their state, mental state, and also other things are similar. Also very common is, we get a lot of people that have suffer from chronic pain issues, and they can't get to their provider and they run out of their medications. It's a very terrible thing. So if they come into the emergency room, we try to, offer them everything they need to take care of all their needs, medically and psychiatrically.
So, and it could be as simple as that. So our message is, if you're seeing these things, before hesitating, bringing your loved one to an ER might result in a solution that could simply be a medical issue or a side effect from a product that they're taking or no longer taking.
Yes.
Some drugs, you can't just cut off medications, they have to be weaned off, and that could be causing some distress.
Absolutely.
But certainly if they're having thoughts of hurting themselves or someone else. So let's talk about resources, because I think that's where the community wonders, now what am I going to do? I just brought my mom to the ER. Are they going to commit her? Is she going to go to an inpatient psychiatric unit? What have I done? So talk to us about Lakeview's Adult Behavioral Health Unit and why that's a great option in this scenario that people need to know about.
The Lakeview Regional Adult Behavioral Unit is a very fantastic facility. It offers great medical staff there, psychiatric, mental health services as well. They even have some physical therapy, occupational therapists there, recreational therapists. We have a great group over there that offer a full line of services for all their needs. So,
So it's a short stay kind of a thing. It's not being committed.
No, obviously, our best way I'd put it is we try to make sure, someone's safe and someone has what they need to live a productive life or live an independent life if they can. And if not, we try to find the right services for them to where if they do need more assistance, we will try and get them that assistance that they need. So we're just trying to base it on their needs. We're not trying to keep people from living their their lives that they want to enjoy. So.
And one of the ways I've heard it described is that, so first of all, we used to call it the senior behavioral health unit, but the admission age is actually 55, and we know that's not a senior.
No,
certainly.
No, obviously.
So
It's 55 and up, although please don't hesitate sending them to the emergency room if they need help that's younger than that, because we'll find the services they need, in other facilities. So obviously we want to help everyone.
So if a senior is brought to Lakeview, and having seen this myself, I worked our emergency room door during the COVID crisis, and we didn't see mental illness for a long time. People stayed home, and I think they hunkered down, but then over a course of time, I was extremely surprised at how many seniors were coming in, either presenting themselves to the ER, being brought in, had people that maybe had drinking problems in the past that had restarted and had been abusing alcohol. And I guess that the family members I spoke to were wondering, how do they handle the guilt that goes with that? Do they feel guilty because they've brought their loved one in and they're basically stamping them with some sort of psychiatric problem? How do we handle that? What do we tell these people?
Yeah, sometimes it appears that way, but sometimes afterwards, once they see they are better, they're actually grateful. They're very happy that they came in. Once we get them better, thinking better, sleeping better, get them back on their medications or whatnot. So yes, sometimes it appears that way. Unfortunately, we have to do what we have to do to protect our loved ones and put them in a position to enjoy their lives again and to live and thrive and do what they can. But when you brought out earlier, yes, they're probably in the beginning, you didn't see a lot because, the fear of them coming out or going to the emergency room because they're fearful of getting it. But this is something that's not really going away really fast. So it's taken a toll on everyone. It's taken a big toll on everyone, and we just want y'all to know out there that we're here. We're here to help. And anything we could do to help out, please reach out. We're going to do everything we can to keep everybody well as best we can.
And our emergency room is safe. We have processes in place to ensure that our senior community or anyone in the community is separated from those who are suspected to have virus. Of course, if they're admitted to our unit, it's usually a short-term stay, and I think it's important to note they wear their own clothing. They don't
We have private rooms, so nobody's in the same room. We have all kind of things in place. They do screenings. They make sure if someone needs another level of care, we're right here on campus. We can provide that care. We have wraparound service here. This is, everything's available.
And it's a medical hospital plus this additional resource for those that are struggling with mental illness. And
yes, we also have great medical services there. We have Dr. Alvarado and maybe some of his associates as well. So I
feel like we're going to get shouts out for Dr. Alvarado.
Yeah, absolutely.
Everybody knows Dr. Alvarado.
And we have Dr. Bob. We have Dr. Deegan Danzero, and also we have Keela Bickham, which is our nurse practitioner. So we have great staff over there.
So the bottom line of this is pay attention to your senior loved ones. Pay closer attention than you had maybe prior to COVID. Expect that things might have changed. If it looks like they've changed, maybe they have. And know what the signs of crisis are and have a plan of what you're going to do. That's always important. We talked about, we'd love to turn this into a podcast because there's so many issues we could get into about how to cope with it yourself, how loved ones can, support. And support is not control. So trying to force your loved ones into services is not support. But I think our best bet is to wrap up today with a couple of online resources that'll be attached to the event on the Facebook page.
Yes.
Certainly LakeviewRegional.com. Click on our services, and behavioral health is listed there, and it talks about the criteria, describes the unit and how to be admitted there. We also recommend CDC.gov because the CDC has great resources for anyone of any age suffering from mental stress or anxiety as it relates to COVID and how to get resources. And we want to also give a shout out to all of our local physicians and family and friends that work with the National Alliance for Mental Illness, NAMI, which is www.nami.org. Yes, tons of resources for family and friends on there of loved ones of any age. But there's just so much to talk about. Our goal today was to make sure that people in the community knew, don't wait. you need to help your loved ones, especially getting
Yeah.
telemedicine services. That's not something that's easy for our seniors. There's resources out there in our adult behavioral health. Many don't know is a short-term stay opportunity, and it gives the family a break sometimes, right? Sometimes.
Absolutely. I mean, sometimes they need a break from their environment. Sometimes, they need, obviously. So
It's like a
please don't-
neutral opinion
yeah,
for the family
right,
also.
right. Sometimes you take a break from your environment. It's a big help already because that environment you're in is very stressful, and sometimes you need to be out of that environment. Although, please don't hesitate to get the help. It's better to always be safe than sorry afterwards. So don't hesitate. We are here to help.
Dr. Rodriguez, thank you so much for your time and all you do to help those in need in our communities that are struggling with mental illness. Please visit www.lakeviewregional.com, behavioral health services, for more information. Thank you.
All right, take care.